The Mental Welfare Commission for Scotland protects and promotes the human rights of people with mental illness, learning disabilities, dementia and related conditions. One of the best ways to check that people's rights are being upheld is to visit them and ask them what they think. We visit over 1,000 people every year wherever they are receiving care and treatment. Often this is in hospital, but it might also be in their own home, in a care home or in supported or secure accommodation. We decide who and where to visit. Often we visit services because we know there may be people who did not choose to be there, either because they are detained under the Mental Health Act or had their care arranged by a guardian. Sometimes we visit because we think there might be particular problems. We meet with patients who would like to tell us about their experience. We talk to them in confidence and listen to what they have to say. We check they have been involved in decisions about their care and treatment and have been told about their rights. We also talk to family or friends of patients, again in confidence. Sometimes we let the hospital know we are coming and we ask them to let patients and families know when we will be there and to explain why we are coming. Sometimes our visits are unannounced, so we really get to see what is happening on the ward or unit on that day. We talk to staff and examine hospital records to make sure that care plans, for example, are up to date and contain all of the information that is needed for an individual patient. We look at the environment on the ward to check that it is suitable for patients. And we're interested in the range of activities and treatments, such as occupational therapy or psychological services that are available for patients. After these local visits, we publish reports showing what we found. These reports do not name any patients or family or friends of patients we spoke to. The reports contain recommendations for change where improvements are needed. They highlight positive feedback and systems that are working really well. We hope that by publishing the reports, services will learn from each other. Anyone who wants to know what we found on a visit can read the reports on our website. We also visit people at home who may be unable to make decisions for themselves and who have a welfare guardian. The welfare guardian may be a family member, friend, carer or social worker and is appointed by a court. The guardian is there to support the person to take any decisions they are unable to take for themselves and to decide things for them if they need to. On these visits, we talk to the person, either on their own or with their guardian, a friend, carer or advocate, to find out how the guardianship is going. We ask if they get support to help make some decisions and whether they are aware of their rights. We can also give advice to welfare guardians who have to make difficult decisions. These visits are also confidential. If any issues are raised in these welfare guardian visits, the Commission can investigate and try to make the situation better. Added to our other work, such as monitoring the law, providing information and advice, and influencing others, our visits are a vital part of how we protect and promote people's rights.